I'm Roland Alexander, medical oncologist, Harrisburg, Pennsylvania. The attacks on the cancer are attacks on how cells grow. Traditionally, we've used chemotherapy as a first attack, and chemotherapy in general consists of medications that interfere with cell division. And this interference with cell division is not specific to cancer cells. So we not only interfere with the division of cancer cells, but we also interfere with the division of normal cells, and that's where the side effects of chemotherapy derive from. In general, we're limited with chemotherapy to a dose that is sublethal. We don't want to give a dose that almost kills the patient. We want to give a dose that the patient can tolerate, but that the tumor cannot.
Hello, I'm Dr. Randall Oyer, Medical Director of the Cancer Programs at Lancaster General Hospital. I don't think that there's any oncologist who's completely satisfied with the way chemotherapy works. We're getting better. We're getting better at identifying who will get better with chemotherapy. We're identifying people who shouldn't be treated with chemotherapy. And we're certainly making chemotherapy safer, and we're developing methods for helping people recover from chemotherapy. But the big issue is we're learning more about the rational use of chemotherapy. Certain types of cancer in the lab respond better to certain types of chemotherapy, and we try to identify that ahead of time. I think that there's more appropriate use of chemotherapy. In fact, we're looking at longer-term chemotherapy in some diseases where the control rate is good, but we expect a relapse down the road. So there are certain instances where maintenance chemotherapy, much lighter doses, much less often the treatment, but there may be some instances where a longer period of treatment leads to a higher cure rate. In other situations, we know that a shorter course of treatment is indicated. In the cancers where we have very, very high cure and survival rates, our attention is now directed at cutting back on treatment. These include things like testicular cancer, germ cell tumors, Hodgkin's disease. We're starting to see more and more long-term survivors, and we want to figure out how we can eliminate or minimize the long-term toxicity. So in some cancers where the outcome has been very good, our attention is focused on trying to figure out if it's safe to give less treatment. And as we figure out more rational use of chemotherapy, targeted therapies, we will use fewer drugs and fewer courses of treatment.
Yes, it's true that cancer treatments can be very difficult, but between medicines that we use to soften the side effects, dosing to make sure that we have a disproportionate effect on the cancer as opposed to the host, the normal cells, often the treatments are much better tolerated than you might imagine.